JXT, the morning show starts now.
Well, aging brings a lot of changes, don't we know it? Your skincare routine is no exception because as you age, your skin has different needs and your skincare should change. So joining me now with a breakdown of what you really need is Dr. DePaquale. She is the founder of Avanti RX. So you brought some models with us.
I did.
And we have them in different age ranges because, as I just mentioned, you really need to change what you're doing as you age through the decades.
You really do. And, you know, it starts easy with very little maintenance. And then through the decades, you just want to kind of add a couple of steps to kind of keep yourself looking youthful.
Okay, so let's start in our 20s.
All right. We're going to go to our 20s model right here. So I have to say, I don't think it gets any easier than this. I mean, really, 20s.
I remember those days.
They say that you're given the skin you're born with up until about 30, then you get the skin that you deserve. So something to keep in mind.
Interesting to know. That's interesting to know. Okay.
So your 20s, really, it's just about general maintenance. So somebody like her, all she would have to do is just do some microdermabrasions to kind of keep those pores unblocked, stimulate collagen, and use good skincare products. And, you know, I'm all about skincare products that are natural without a lot of chemicals. So it's a good time to start educating yourself about what chemicals are in what products and what things you want to stay away from. So real easy. Not a lot to do here.
Yeah,
you know?
but still very important to make sure that you're doing some things along the way.
Right, because some people think, well, I look fine, and they don't really want to do anything until there's a more significant problem.
That's a big mistake. And I've learned that. I've learned that from you over the years that you've been coming in. Absolutely. Okay, so now we have
So we get to the 30s. And now here we're giving away everybody's age here. You know? So we're telling all the secrets.
There's still a good 10-year bump in there.
So in our 30s, not too much else to worry about. I mean, but I would still continue with the microdermabrasions. I would still continue with good skincare products. But sometimes you may start to see some fine lines and wrinkles. So in addition to your normal skincare routine, I would definitely suggest adding a retinol product because that's going to help with fine lines and wrinkles, improve skin cell turnover, and improve the texture of your skin. So anybody who's in their 30s should be using a retinol product, but again, stay away from the ones with the harsh chemicals and, you know, make sure you get one that's least irritating, and that's for another subject. But also, sometimes people will also get a little bit of volume loss in their 30s, but typically it's not so bad that it's very, very easily correctable. So it just depends on the person. Some people have more volume loss than others. So,
and sunscreen. Important at any age.
Yeah, sunscreen. Yes. How did I forget that? I'm always talking about sunscreen.
And that's very true. I mean, that's one of the things that I know you're big on because that is one of the things that will age you. Lack of using it will age you faster than anything.
Absolutely. So true. So that's I mean, those are the big things. And these girls have obviously done a good job keeping up with them. That's why they're choosing to be the models for today.
Absolutely. They look great. So we have our 20s or 30s. Now, if you're wondering what to do in your 40s and 50s, I can be your another model on this side,
the other side.
So we're going to come back in a moment and give you the steps that you need to take in those decades. We are back with Dr. Pasquale, who has Avanti RX, and that is a really great line of facial products. And we're talking about how to care for your skin in your 20s, your 30s, and now your 40s and your 50s. So in the 40s, that's when things really start changing.
They do. They start changing. So your general routine maintenance kind of goes up with each decade, as you've seen. So in your 40s, you want to do what you've done in your 20s and what you've added in your 30s, and then you're going to add a little bit more. So usually 40s, you know, if you're kind of a thin person, typically you're going to have some volume loss in a couple of different areas. Most commonly under the eyes, where you start to get a little bit of a hollow kind of look. It happens in the cheeks also. Nasolabial folds in this area, and sometimes the marionette lines, and also the lips. So those are the first few places that you tend to see volume loss in a 40-year-old, and sometimes even in your late 30s, depending on the person. Now, some people, if they have a little bit of a fuller face, some people may actually have folding over of their skin, and if you get filler a little bit earlier, it's actually easier to reverse that problem than if you wait too long.
And you know what's surprising to me is that filler really can fix both of those problems.
Oh, absolutely. Yeah, it's amazing what filler can do. And people are often afraid of filler just because they think they're going to look overdone.
And that's what I just said in the commercial break. That's the thing. I haven't. I've had Botox a lot, but I mean, I have not done the filler yet, and I'm 44, and I'm really like thinking, okay, you know, maybe like just to tweak little things.
Oh yeah, it's great to make little tweaks, and it's not as scary as people think, because that overdone look really has to do with either a doctor who didn't listen to what you wanted, or B, over injection. You can always add more. I'd prefer to do that rather than add less. And, you know, I mean, if you overdo it, you can't take it out. Well, you can, but it's a big process. You want to rather do a little less and add more as we go.
Well, and you just want to look like your best self, right?
Exactly.
I mean, you don't want to look different. Okay, and then, so now our 40s, now we have our 50s.
Now we have our 50s.
Who is our lovely Ann Roy.
That's right. So, and in the 50s, things can change a little bit more, so you want to consider all the things that we've already talked about. The big thing that I would think about in the 50s, and even in the late 40s for some people, is a Fraxel treatment. So Fraxel is just an amazing, revolutionary laser. It's not a razor. But what it does is it's partially ablative, and we can do two things with that. One, for people who have the dark spots and pigment, that doesn't go away with skincare products if it's a little bit more severe. That will erase that pigment. It also helps with the fine lines and wrinkles. So that's something that should be considered in the 50s. It could be done on your face, your neck, décolletage, hands. It removes stretch marks. So it's really pretty amazing. Yeah. Right. And the other one is the deeper treatment, and that's more for the wrinkles. So that's deeper. It'll kind of build collagen, improve the wrinkling, and it also gives everybody a little bit of a lift. So that's kind of nice.
All right, so thank you, ladies. You all, I mean, and you all look fabulous. All four of you, well, all five of you, of course. And if you'd like to know more about Avanti, we've posted a link on the morning show page of news4jax.com where you can find all those products and just have them sent right to your house. Vic?
All right, great.